Awesome, thanks. All right, so welcome to today's UW System Career Track. My name is Shelley Auer, and I'm here with Brianna Burke from the UW Stevens Point Career Team. And we are very excited to host today's Career Track for UW System with our guests, Kathy and Sarah from Marshfield Clinic Health System. So we appreciate you being here today. I have a couple odds and ends that I have to cover before we kind of jump into the great stuff that is going to be shared with you during today's presentation. So a bit of background on why we're doing this today. UW System Virtual Career Tracks is a UW System initiative, which aims to connect career offices, employers, and students. And we're super excited that UW System Interim President Tommy Thompson has given us the go-ahead to keep doing these things, just because we found them very valuable in connecting students with employers around the state. So our thanks to UW System for making this possible, and to the career folks and the employers who partnered up with us to collaborate and showcase their great stuff. The official registration form is linked in the chat. So if you haven't filled that out yet, please see the chat and submit your information. That's how we record today's attendance for the event. So I know especially for our UW Stevens Point folks, if you are looking to get class credit, we need you to submit that form, and we'll be sharing that throughout today's event within the chat. So a bit of housekeeping. The chat today is being recorded, and it's going to be available for viewing by noon on Monday. UW River Falls hosts the recorded chats, or the tracks rather, and we're going to provide the link for those in the chat as well. Quick shout out to our friends at UW Whitewater. They will be hosting TDS Telecom at the next UW System Career Track. So just as a heads up for that. And finally, Brianna, if you're okay with it, I'm going to ask that you launch the live poll, which is a link to a brief survey or the live poll within Zoom so that you can identify your affiliated school and then your school year. And this helps our presenters today kind of gauge where people are coming from or where they're represented at. And the great thing about Marshfield Clinic Health System is that they have representation all over the state. So they are going to be super excited to see students represented throughout the state of Wisconsin, not just with our awesome school of UW Stevens Point. So if you could fill that out, that would be amazing. And then we're going to go ahead and get started. Just a quick reminder, we're again going to share this throughout our trek today, but make sure that you fill out that registration link, and then we can make sure that you get event attendance or our attendance is recorded. So now that that's out of the way, I'm super excited to introduce Kathy and Sarah to talk more about Marshfield Clinic Health System. Oh, sorry, Brianna, do I have to go over what's on here on the poll? We have representation from Green Bay or Oshkosh, Whitewater, Madison, Eau Claire, River Falls, Stout, and Stevens Point. So thanks for being here today. We're going to swap slides really quick and then jump into the good stuff.
All right, let's get our slides up and going here real quick. Welcome to our presentation of Marshfield Clinic Health System. I am Sarah Salisbury, and I have my coworker Kathy Mitchell here with me today. We are 2 of 18 recruiters within our system, and we're just going to kind of give you an overview of, you know, who we are and what type of candidates we look for. I'm going to go ahead and jump into the history of Marshfield Clinic. So we were founded in 1916 by 6 physicians, and Marshfield was our only location until 1976 when we established our first satellite location in Mosinee, Wisconsin. Today we are one of only a few large independent nonprofit medical clinics in the U.S. with now over 60 locations, including 10 dental clinics and 9 hospitals. We do have a 10th hospital on its way coming in Stevens Point next year. Here is a snapshot of where we are today. A few important pieces to point out are our Security Health Plan. Security Health Plan is our health maintenance organization owned by Marshfield Clinic. And they do provide health insurance options to more than 200,000 individuals within all 72 counties in Wisconsin. Our children's hospital in Marshfield is one of only 4 in Wisconsin. And our Marshfield Research Institute is the largest medical or private medical research institute in Wisconsin with 6 centers. And we do partner with the University of Wisconsin School of Medicine and Public Health as an academic location. Marshfield Clinic Health System's mission is to enrich lives through accessible, affordable, compassionate healthcare. Our vision is to be the patient's first choice for healthcare. To do this, we have the following values that guide us. Being patient-centered, always putting the needs of the patient first. Trust, we earn trust through honesty, integrity, respect, and compassion. Teamwork, we work together respecting each other and our different roles. Excellence, through research, education, and best practice, we deliver exceptional quality. And affordability, we are accountable as we manage resources and deliver value-based care. These values motivate the Marshfield Promise. We want to ensure that those we serve feel supported in their healthcare journey and that staff and providers are actively engaged with one another. Together, through our actions, we promise to deliver compassionate, safe, and expert care to everyone. Our promise and the actions we follow are what build our culture. We demonstrate this by these 10 actions related to our values. Again, being patient-centered by connecting with purpose, saying please and thank you, using the 12-6 rule, within 12 feet of someone, making eye contact, and within 6 feet, verbally greeting them. Trust, do what you say you are going to do and make sure you follow through. Be an active listener when speaking with someone, be mindful and present of what they are communicating. Teamwork, we are one team, always be respectful, cooperative, and supportive. Excellence, be the best that you can be. Use your talents and resources to demonstrate your commitment. Affordability, use resources wisely. Use time management, materials, and resources to ensure the greatest value for those we serve. Identify improvement opportunities to be more efficient and effective. So what are we looking for in candidates? Of course, after meeting the minimum requirements of education, license, certification, and experience, we are looking for individuals who believe in our mission and support our promise by, again, being patient-centered, putting the patient first, taking care of them and their families so they choose us again and keep coming back. We're looking for individuals who are committed to taking care of our communities, looking for great team members who support the team and their colleagues they work with, active listeners, obtaining trust with others. We're looking for individuals who are wanting to learn and grow within the organization to show that they are dedicated and committed to Marshfield Clinic Health System. So I am now going to pass it over to Kathy.
All right, thank you, Sarah. So if you're wondering just how do I stand out as a candidate, there's some things that you can do, opportunities to shine when you're applying for positions. Some of the basics are just what you might want to focus on. So it's very easy in this day and age to use technology to help complete applications, but just paying attention to detail. With our system alone, you complete an application with your education and experience. And then we also have a list of questions where you're going to be asked to let us know whether or not you're going to support our mission and vision and values. And it's a yes or no question. It's going to ask you for an example of good customer service experience. your references, your availability to start. And so what we look for is really a complete application and taking the time to fill out all those fields and give us as much information as possible. It's your opportunity, your first connection with really any organization to present yourself. A lot of our positions would warrant a cover letter and also a resume. And having those things uploaded in your profile is great. And with our system, you create one profile and then it becomes pretty easy to apply for multiple positions depending on what you might be looking for, or if you're open to moving and working in multiple areas. Making sure that that cover letter, for us, it's really about your voice. The application gives us the details of, education and dates and your job history, but that cover letter is your opportunity to really sell yourself and your personality. It's really, as you read through it, your voice to sell yourself. Resumes, I was on a program about a week ago talking with some newer grads, and having an easy to read resume, giving us dates, something easy to read that might highlight even projects or different community associations that or groups that you're a member of is also good to highlight. Some of the basics, I don't know, it happens kind of often, but making sure your voicemail is set up. We primarily call you first to set up any interview or pre-screens, and having that voicemail set up is very handy. And then make sure that your voicemail is empty and not full, because we often run into that as well, that the mailbox is full and we can't leave that message. Probably another thing just to make mention is, what does that voicemail message that you've set up sound like? Is it professional, or is it one of those, hey, you know what to do, just, leave a message? This is, again, an opportunity to, if you're looking for work, make sure that you've got that set up professionally. Other items is references. One of the things that we do pretty early on is check references. And so during a pre-screen with one of the recruiters, we might be asking you for those references. Making sure that we have good contact information, email, phone numbers, and then also take the time to maybe reach out to your references that you have listed and let them know you might be getting a phone call. That's going to speed up the process. And the last thing you need is for someone to, for us to call and have them say, oh, I don't know that person, or gee, they didn't let me know. So make sure that you do that as well. Thank yous. That might be kind of old school, but I would say that if you have an interview, if you meet with managers, in this day and age, we're doing things by phone. We're doing video interviews. Sometimes we are able to bring candidates on site. And really with COVID, it's been a combination of multiple things. And in many of our centers and sites, we have a no visitor rule depending on where things are at, but at any of points along the way, whatever opportunity you have to interview, getting a thank you afterwards, or sending a thank you afterwards to managers is really something that can help you stand out. It's not common that we get those, and those that we receive really do make an impact. It's another chance for you to wrap up and just tell us that you're still very interested in the opportunity. They can be by email, they can be, I would say a lot of us are working remote, so we're not in the office to pick up mail, but I would say, email is certainly a positive way to get that message back. During the interview process, and especially for us, be prepared to show examples. If you don't have a long work history, What other examples in the classroom or projects you've worked on? Share those. We really are looking for folks, like Sarah mentioned, that are about making those connections with our patients. Healthcare is like nothing else in that you are dealing with folks at a very vulnerable time. It's very quick that folks coming to us, be it for just a routine exam or being hospitalized, that they put their trust in us. So any examples you have of connecting and taking care of others, going above and beyond is going to be good for healthcare. It really is about helping others. For Sarah and I, we're not frontline with patients, but we're there to help support the managers and the staff and the teams that are taking care of those patients. So that's pretty key. And then really being responsive during the interview and recruitment process. Let us know the best time to call you. If it's, in your availability, let us know that calling me in the evening or email is better than a phone call. That's going to help us connect with you rather than playing phone tag. We know students are busy, hands down. You're in class, you're studying. If you're working as well, you've got to juggle all that time. And then also obviously trying to get your sleep so that you can stay healthy. Those are all things that are important. So the easier that you have for us to make sure that we value your time and kind of speed up the process. I would say for us, primarily, we use phone and email as primary ways to contact folks. I know sometimes folks might leave us messages that say, go ahead and text me. It's really not, I don't believe any of us, have, or not everybody has that capacity to text candidates. So I would say that phone and email is the best way for us to stay connected. Next slide, Sarah. Thank you. Really, how to apply for jobs. I would say the number one source that we hear from candidates is that they hear about our opportunities on Indeed or LinkedIn. But I guess I would encourage you, if you see something out there, that's great, but I would just encourage you to go directly to our website. Looking at marshfieldclinic.org, there is so much information out there that you can find opportunities. And so one of the things is our main homepage. Right there at the very bottom, there's a career link, and it's going to bring you to the picture of the screen that you're seeing right now. We have kind of two different links. In the pink, we've got physician openings, and then we also have all of the non-physician openings, and that's a fast way to just click on the link that you need and to get to that listing of opportunities. And you want to advance, Sarah? We'll go to the next. The way our system is set up is that you can do filters once you get to that career web page. And you can look at, if you're just looking at nursing, or if you're only looking at a Stevens Point location, you can really narrow down opportunities. You can also, like I said, create the profile. You can upload your resume and cover letters. And then one of the nice features is this screen that you're looking at right now is, once you're in that profile, you can set up for job alerts. And really what you're doing is the system will email you when something new gets posted. That way you don't have to check on a regular basis. You can set up what type of positions you might be looking for. And as soon as it gets posted, you'll get an email to apply. And that is a great way to keep you in the loop of what's open and available on a regular basis. Some positions are up for a while. Others might have a limited amount that they're posting, and you just don't want to miss those opportunities. I would say too, as far as since you are students, if you're getting close to graduation, like right now, what we're starting to see is those folks that are graduating maybe in the December timeframe. Applications are coming in right now. In the spring, that early I would say February, March, April, even if you haven't completed that program or you don't have your license yet, it's letting us know that you're interested. And with an interview process that can take a little bit, or just to maybe, take off the burden of one thing is to sometimes be able to secure a position before you've graduated. It might have some contingencies, like if it's a nursing program, make sure you have your license, social work, that might be one thing that's out there, but wouldn't it be nice to have a job ready and waiting for you, and then you can focus on wrapping up clinicals, internships, and studying for tests and licensure. On the flip side of that, we are also, if you want to just focus on just getting through, the lights at the end of the tunnel, you're almost there. It's fine to wait and jump on after the fact, to be able to present to us that, yes, I have my license, I've graduated. I had my vacation because I've been really busy for 4, 6, 8 plus years. And then you're ready to go. So those are some things to kind of think about as you are looking at life after college and university. Next slide, Sarah. But what about opportunities before you graduate? How does that help set you ahead? Like was mentioned earlier, Marshfield Clinic Health System, we are throughout the whole state, primarily in the northern rural sections, but you'll see in a later slide just how many locations and UW schools we sit in. From Beaver Dam, which is pretty much the furthest south, about 20 miles north of Madison, to further up north. One of the programs that we have is the Wisconsin Academy of Rural Medicine. So anyone that is looking on that track for a physician, is we host students who spend their 3rd and 4th years of medical school out of the UW-Madison here at our centers. You have the opportunity to work in small sites and clinics, larger hospitals, and it really gives you that opportunity, which I think is nice for any kind of internship or clinical experience, is really going to give you a sense of what would it be like to work there at those facilities. Sarah and I can tell you that we are, patient focused, and we are all about the team, and it's friendly places to work. Our teams are great. We're smaller, so you're not lost in the shuffle of a large system. But again, if you have that experience as a student in one of our facilities, you'll know what is it like to be there. We also have different residency and fellowship programs for pharmacy. Marshfield has a residency for nurses. And what I didn't list here is we often hire at different sites for speech and language pathology fellowships. So right after graduation, you can come and do that fellowship with us. And some of those opportunities are just temporary. Other times they can turn right into a full-time job when you complete your competencies. So that's great. Nursing, we have summer nurse internships, and then that also rang a bell. I saw quite a few of the folks that might be online listening to us today are looking at computer systems, IS, information systems, and they also do internships throughout I think primarily out of Marshfield, but it would be something to look for. We also have a School of Radiology that's in Marshfield. So in connection with some of the UW schools, you might have your bachelor's degree or your associate's degree, and you want to switch gears and be on site in Marshfield, in the classroom and in the field, in the department, learning how to be a radiographer. So that's a whole different experience that Marshfield does offer. Some of those basics like job observations and clinicals, those are all offered. And what I'm showing you here, that picture is really our Division of Education. And again, a wealth of information and can guide you on how to apply for, it's kind of like applying for a job, but just applying and putting in your request to do job observations, to do clinicals. We have contracts with a lot of different schools, and folks come to us to do the hands-on learning. COVID again has kind of challenged us with maybe different experiences or limited experiences, but students are back on site doing clinicals, job observations. It would be something I would just encourage you to look. It might not be open yet, but we know it's going to be coming back. And then volunteer opportunities. That's a great way to, if you don't need the paycheck, to be able to, be on our sites doing any number of things, working with patients, being at the information desk, helping out in the surgery center to take care of patients, sitting with patients, visiting with patients. There's a lot of variety that you can do being a volunteer that's going to give you great experience in healthcare. It's going to set you apart from someone else who might not have had that experience. And it gives you a comfort level. Until you get into the field and sometimes have an experience, you might not know what you like and what you don't like. So the faster you can get that experience, the better off. I often tell candidates that I talk to, it is good to know what you don't want to do. And so sometimes you can speed up that process of learning what you like to do and what you don't like to do by being a volunteer or doing any kind of job shadow. Next screen. And again, this is just sort of, taking a look at all of the schools in the state and just where we are located. And maybe Milwaukee is the furthest one away, or Green Bay, and Whitewater. But again, we've got those opportunities, and we continue to grow. Like Sarah mentioned, we're opening up a hospital in Stevens Point. Last year during COVID, we brought on hospitals in Park Falls, Weston, and also Beaver Dam. So that's huge if you're looking at opportunity of an organization that's continuing to grow, because COVID slowed a lot of things down. And so, we have our own experiences with that. But again, there's a lot of growth and opportunity. During COVID, we opened a hospital in Minocqua. So that got delayed a little bit, but we still made it happen. And again, if you think about just different opportunities, I took a look at sort of the roster of who all was joining us today. And if you're in business or you're in accounting or finance, we have those departments as well. And maybe it's not something that you ever thought of if you think about healthcare. We might not have as many positions like we do with our physician openings, nursing openings, pharmacy, CNA, those frontline clinicians. But behind the scenes, we do have a lot of different positions for business, finance, marketing. I saw some marketing folks on here. We've got nursing, we have research, education is another one. Our education department has hundreds of staff. If you want to think about IT, our IT staff is 400 plus. Positions can be remote. They can also be on site. We have a legal department. We do logistics. We have food service. We have dietitians, oncology, information, HIM, our health management, our coders. We have dentists. The list goes on and on. And like I said, also on the list, I saw someone with the kind of that speech background, obviously rehab services, PTs, physical therapists, occupational therapists, and speech and language pathologists, social workers. I did see someone that is looking for a field in genetics. And again, we have genetics and got a couple positions primarily in our larger facility like Marshfield. So there really is a lot that can be offered within healthcare that you may or may not ever think about opportunities. So that's the plug for that. Next slide, Sarah. And then really why healthcare? It's, I was relatively new to healthcare when I joined. I had work in hospitality, I'd been in manufacturing, and healthcare is like nothing else. I think one of the things that you'll find is that there is just a variety of job opportunities. You can be a frontline clinician, or you can be behind the scenes in that support role, because it takes everybody to really help take care of our patients and our communities. We have a lot of folks that start with us, even those folks that are in housekeeping or food service, delivering meal trays, that are in school to kind of continue to grow their career and their goals. You can advance. You can begin as a CNA, become a nurse, go back, get your bachelor's, your master's, become a nurse manager, become a leader within the organization. You can continue to grow. And a lot of our departments help support the education. We do education reimbursement. For those that need state licensure, like our physical therapists, our nurses, our doctors, our dentists, we'll help you get those continuing ed credits. We'll help you pay for the licensure or reimburse you for that. That's nice too. And then really, we took a look at the listing of job titles within our organization, and over 2,000 different job titles. Again, healthcare continues to grow. If you're looking for opportunity after you graduate, 15 of the 30th fastest growing occupations are in healthcare. They're in business, they're in IS, nursing. One of the things that we talk about is a lot of our nurses are starting to retire, and we've been watching this for a long time, and we've got to be ready. And we often do talk to middle school age and high school age just to get folks interested in healthcare, because the jobs are going to be here. They're not going to move to a different state or a different country. We have to be on the ground to serve our communities, and we've got to be prepared for that. Beyond that, if you work in healthcare, I like to tell people it's hours that can fit your lifestyle, and it can change with you. We have casual folks, we have full-time, we have part-time, we have folks that work 4, 8, 6, 10, 12, 24-hour shifts. And it can change. You might be single, you might be in school, you might get married, you might have kids, you don't want to work weekends. There's a lot of flexibility in healthcare. And the nice thing with Marshfield Clinic Health System is you can change a position, you can change a job, maybe a different department, but not change the people that you're working with, or your hire date, or your benefit package. And that's huge. And probably number one, reason why you might choose healthcare is just that personal satisfaction. Again, folks go into healthcare to take care of others, and there's nothing like that when your focus is about a patient or a family member. And we don't want folks to have to hit our hospitals. We do want people to come into our clinics and stay healthy, but we are here when you need us. And I think everyone has had that experience. And you remember what it's like when you stepped in the door, if you had to bring a family member into the emergency department, or you were having a baby, or you had to go to your family doctor and have just a regular visit, and you got a clean bill of health, or you got news that maybe you didn't. And that is huge. And you can make that difference to people in your family. And you really want to, you remember those times, you remember those moments, and the community looks to us for that. And you can't do it without your team. And I think Sarah and I are, we've got busy jobs and we're behind the scenes, but we're always saying we couldn't do everything that we do without the great team that we work with. And we can also work with the managers and the staff. And that's really what it's all about. So I think that's kind of wrapped up our presentation for today. We certainly want to thank you all for your time, and hopefully you'll jump on our website and take a look at those opportunities. And if we've got time, we're available for questions.
Awesome. Thank you so much, Kathy and Sarah. I really appreciate everything that you shared. Just to echo, we're going to have some Q&A time right now. So if you have questions for Kathy and Sarah, feel free, or questions about Marshfield Clinic Health System in general, feel free to share those in the chat. And Brianna and I will share out those questions so that Kathy and Sarah have an opportunity to answer. Just to reiterate, I heard throughout the entire presentation that connection to community and being part of community, and being in central Wisconsin, I'm going to testify to that. The students who I work with are so interacted and interconnected with Marshfield Clinic Health System, and having gone through the COVID stuff for the last couple of years now, students would stay connected in the communities they were in, and just seeing the impact Marshfield Clinic plays within so many different communities and so many different levels, even being connected to AmeriCorps positions and doing such healthy community initiatives. You don't have to be a healthcare direct patient care type of position to get connected to Marshfield Clinic. So please, it's worth a check. Just look at the website, check out the different opportunities, because you never know what you'll find until you find it. So please take a look and see. But if we have questions, feel free to share those in the chat. And I'll step off my soapbox for a bit to start the questions, because, I heard that sense of community and that resonates with me quite a bit. If both of you could share, what's your favorite part about the workplace culture, or something that really stands out to you that's like, yeah, this is why I love Marshfield Clinic Health System?
I can go first. So we actually had a recruitment event yesterday afternoon at our Eau Claire location, where we invite individuals to come in to learn about positions and talk with hiring managers. And we had a hiring manager for our hospital come down talking with a CNA candidate, and how she explained the environment there was just, I fell in love with how she explained it, because she's like, it's like a small town, the small town feeling of, you're welcome and embraced when you come. You have the opportunities to cross-train in the different areas, whereas in other organizations, you do your position. That's it. Where we're here, we're really looking to welcome you as family and help you grow in different areas and kind of expand. So,
Thanks.
Yep, I would say the same as well. It's just, like I said, it's a tight-knit community. And I think we have some of those things that we do just to support the community. Right now, we've got, I sit in between the Rice Lake and the Ladysmith campuses. And one of the things that we're doing is we are building a new facility in Ladysmith. And so one of the things that's happening is there is the topping off ceremony. So when they get to a point in the building process, they can, there's a beam that gets placed at the very top of the structure, and that beam was available for the entire staff to come together and sign. So our names are on there. There were treats involved. We give back to the community. Sometimes different businesses might bring us lunch, and just to say thank you for everything that we're doing. But it's just, you're not just here to do just that one thing and that one job. If you want to be on a committee, if you want to be involved, if you want to get to know and say hi in the hall, it's going to happen at our locations. And again, it's constantly growing. And like I said before, we certainly couldn't do what we do without folks just, helping each other out and tackling the big stuff. And I always say that, if you can get anything done and you can do anything, you can deal with a crazy shift or a crazy evening if you have the right people on the team that will just step up and make you laugh when you're like, I can't do this anymore, but help you get through. And that's what you can experience.
Thanks. Thanks so much to both of you for your answers. Heather shared a question in the chat. Do you hire international students for internships while they are in school? And the second part to that question, and then full-time work after they graduate.
Sarah, do you know the question or the answer to that?
So for internships, I would have to look into, that might go through more of our student programs department. And, you know, so they would maybe know kind of what type of visa would be required for that. For permanent positions, we do work with international individuals, depending on the qualifications of the position. In order for us to be able to sponsor an individual before they have citizenship, we do need to have, the position has to require a minimum of a bachelor's degree. So anything that would accept an associate's or high school diploma with experience, we unfortunately would not be able to sponsor that individual. But yeah, so anything minimum of bachelor's and above.
Okay, thanks. Heather, if you had any follow-up questions, feel free to post. Heather said thank you. And Linda has a question as well. And I'm going to read this. With some healthcare systems struggling to find employees for open lab roles, they have created positions that are part of a training program that provides experience and training to allow the employee to meet certification requirements with ASCP or AMT or other related certifications. Does Marshfield offer something like this, or are there plans to offer? This would be for a science major like bio or biology or chemistry that is not a graduate of a certified program like med lab or med tech, etc.
That's a good question. And I think right now, let's see, I know that within our lab, because we certainly have lab at all of our sites, as well as a very large department in Maine Marshfield. We've created some newer positions that are lab assistants that give us that flexibility to, that, like you said, to become more creative when we're having a hard time to fill a position. I guess I'm not aware of any program, and that's something that we could look into. And what I can share is with our different recruiters, we do have 2 recruiters that focus primarily on lab. So Sarah, do you know if they have any program like that?
I haven't heard of anything, I guess.
And that's something that we can certainly, you know, look into and get that. If there's a way to get these answers back to you folks, I mean, let us know. We can certainly do that.
We can definitely follow up.
Okay.
I know even because consortium agreements are not a new thing for the UW schools and different employer or other technical school partners. Maybe that's something that we could come together and formulate. I know internally we've talked about, like, is there some type of certification add-on that our biology and chemistry students could pursue because they're more interested in laboratory, like med tech work or clinical lab science focused work, but they didn't want to pursue that specific path. So that would be awesome if something came of that. Thank you, Linda, for that question.
And I think the other thing, we do have an example of that right now. We've got a pilot program for that we're working with, I believe it's up in Minocqua, where right now for our organization, medical assistants, we have a lot of openings on the medical office side for medical assistants, and that's, you know, a 2-year tech program. And right now we have a pilot program where it's exactly what you're talking about. It's a position that we're creating, and once they complete that program with education and with the state, to say that the training that they have can get them that certification that they need. So yeah, I think we'll see more and more creative opportunities. Just wish we had more time to get it all figured out before the need is there. But yeah, those are things that we're going to see pop up. Yep.
Awesome. Yeah, I heard more of those conversations come up throughout the last year and a half, specifically with trying to meet the needs of different healthcare positions. So yeah. All right. Anyone else have any questions? Brianna, do you have any questions you'd like to to share out? Otherwise, I have other questions I can ask too.
Go for it, Shell.
Okay. So what advice would you give to folks who want to work with Marshfield Clinic Health System after, like, before or after graduation? Like, if they could take, I know you shared stuff throughout the presentation and it was super helpful and we'd echo everything that was shared. But if there's like one takeaway that you see consistently that you want people to kind of take home with them, what would that be if they want to connect with Marshfield Clinic Health System?
I'll have two things that I might mention. So, on our website, if you have any questions, I would say that we have like an HR helpline. If you want to make a connection and with regards to recruitment and get you to the right recruiter, you can send in a message. We get them all the time. And, I'm interested in this area and this type of background, who can I talk to? And then it goes out to all the recruiters and someone just says, yep, I'll follow up with that person. So you're going to get some feedback directly from a recruiter that's going to make a connection. And then the other thing I like to share is with really anyone I talk to that's looking for work is I've been with the organization for almost 17 years and always in human resources. And what I can tell you is that I applied for my position 3 times before I actually got my position. So, I think I tell people it's all about the number of candidates in, at that time that you apply, and I guess for me, it was not getting discouraged, continuing to apply and, like I said, making those connections with the local folks. And that was my experience. It took 3 tries and they gave me a shot. And I'm still here. So that would be suggestion number 2 for you.
Thank you. Sarah, what about you?
I guess, I don't have much more to add than Kathy has mentioned. But yeah, like she said, don't be discouraged if you aren't selected for the first position that you apply to. Definitely keep applying if that's an interest of yours. We have, especially in like our IS and pharmacy areas. Sorry, those are a couple areas I recruit for, so that's what I see. I mean, they're definitely competitive, and so don't be discouraged, keep applying. And yeah, definitely reach out if you have questions and, keep those connections with individuals in that area.
Awesome. I appreciate you sharing the note on persistence and staying connected and not getting deterred. We share that same key point within like state and UW system positions as well. So I appreciate you sharing that here. And we're going to end on I have one final note or question. We can end on something super positive. What are you most proud of when you reflect on the work that Marshfield Clinic does?
For me, it's being in the communities. I guess what I love about my job is just connecting with so many different individuals across the state and bringing them into our organization to do what they love to do and help those patients just, as you can tell, we're very patient-centered. We want to keep bringing individuals back. And so that's just what I love about my job is just, bringing in individuals who want to do that for our patients. And it's fun to see just how many communities we are in and lives that we touch.
And I would say it's this, it's going to be that growth, staying local. And I too, like Sarah, I, really enjoy talking with candidates and sometimes might find myself saying, oh, have you ever thought of this or that? So if the job we're talking about isn't going to make a connection, if people are open, I like to try and talk about, well, other things you might not have thought about. So thank you.
Yeah, I appreciate you both sharing that. So we're going to wrap up now. Brianna, do you have any parting words of advice or anything?
Not parting words of advice, but I'm so excited to continue to see Marshfield Clinic expand. I use the Stevens Point Center, and I know it's been under construction for a really long time. So I'm excited to see the hospital finally come to fruition there. But as someone from another part of the state who wasn't familiar with Marshfield Clinic really until I moved up here, it's really exciting to see that the work you do and the research you do and the contributions that you make to the healthcare world here in Wisconsin. So,
And that focus on rural care, I think, stands
yes.
out to me because Marshfield Clinic is so focused on that, providing equitable healthcare to all people in the state of Wisconsin. And that's pretty cool. So I appreciate that. Thank you, Brianna, for sharing. So our thanks to our presenters, Kathy and Sarah. Thank you so much for sharing with us, and to Marshfield Clinic Health System for their partnership within today's event and their continual focus on healthcare research and community throughout Wisconsin. So thank you again. Take care, be well, and if you have questions, be sure to contact Marshfield Clinic Health System.
All right. Thanks.
Thank you.
Bye.
Thanks, everyone. Have a great day. Hi, we're all done for today. Do you have any questions? All right.